Good evening and welcome to tonight's Medtronic Diabetes webinar. Tonight we'll be talking about pregnancy and insulin pump therapy. Joining us will be our two guest speakers, Associate Professor Glynis Ross and Medtronic Diabetes Australia Ambassador Tracy. My name's Dean Kanakis. I'm a part of the Medtronic Diabetes marketing team here in Australia, and I'll be your host for tonight's event. Just before we get the questions kicked off, just a quick reminder around our social media. If you do want to post a live question in this event, please use our Twitter handle for #640G webinar, or jump onto our Facebook page, Medtronic Diabetes Oz, and you'll see a post there with the link. Okay, so just to introduce our speakers, our first guest speaker is Associate Professor Glynis Ross, President-elect and Vice President of the Australian Diabetes Society. She's a visiting endocrinologist at Royal Prince Alfred Hospital, Sydney. She has been in charge of the Diabetes in Pregnancy Service at Royal Prince Alfred Women's and Babies Hospital for 20 years and has been on the Council of Australasian Diabetes in Pregnancy Society from 1991 to 1998 and 2002 to 2010. Welcome, Professor Glynis Ross.
Hello, thank you.
Okay, so over to our other guest speaker, Tracy. Tracy recently experienced pregnancy while wearing an insulin pump. She's currently working as a business development manager and managing her diabetes with the MiniMed 640G system. And she's been a Medtronic ambassador here since June of this year. Okay, so on to our first question. This one's for you, Tracy. So have you always worn an insulin pump, or did you decide to start insulin pump therapy when you were planning your pregnancy?
So I've been on an insulin pump for about 7 years, and I've recently had a pregnancy. My little girl's now 10 months old. Yeah, but I've had diabetes for about 22 years, so the pump's been great.
Okay, glad to hear. Thank you very much, Tracy. So over to you, Dr. Ross, or Professor Ross, sorry. I feel I have great control with injections, although I have had pump therapy suggested to me. How beneficial is using an insulin pump whilst trying to get pregnant and during the pregnancy?
Well, if you've got very good control on multiple injections, it may be difficult to see clear improvement of your glycemic control on standard glucose monitoring. But what would be worthwhile would be to consider having a continuous glucose monitoring study done through your diabetes healthcare professional, because you might find that there is much more variability and swing in your glucose levels than you're picking up from your routine testing. So one of the big advantages of an insulin pump is that it does tend to reduce the swings in your glucose levels, so that you tend to have less tendency to very high glucose levels and less to hypoglycemic levels, and that smoother level of control is also a huge advantage. So even though what you hear most about with diabetes is what's your average control, what's your A1C, it's also extremely important to try and reduce the glucose variability, and so you're not wanting a lot of swings up or down in your glucose levels. Really important outside pregnancy, but particularly important in pregnancy. So again, I would suggest that you consider exploring what's really happening with some continuous monitoring and see whether there is more swing than you expect, and if there is, a pump may be a better form of it delivering insulin for you.
Okay, thank you very much, Professor Ross. All right, guys, just another quick reminder before we jump back into the questions. If you do have a live question, please reach out to us through our Twitter using the #640G webinar, or onto our Facebook page, Medtronic Diabetes Oz. Okay, so back over to you, Tracy. When you were in the 3rd trimester of pregnancy, did you find the pump got in the way?
No, absolutely not. The pump, towards the end of my pregnancy, I used to put on my love handles. So, no, it was easy to inject there. I just sort of stayed away from the front part of my belly, obviously.
Okay, thank you very much for that, Tracy. Okay, so back over to you, Professor Ross. My partner and I are trying for a baby. Should I get a pump now?
Okay, so if you've got diabetes and you're planning a pregnancy, there's a whole range of things that are really important to be doing. So if you're thinking of going to an insulin pump, it would be preferable to try and do that well ahead of trying for pregnancy to make sure that the transition over is as smooth as possible, that you get very confident with the use of the pump, and you're getting the best out of the insulin pump. But just remember that there are a whole lot of other things. So if you're thinking about a pregnancy, aside from the specific diabetes-related things, it is very important to start to make sure, first of all, that you've done your general health checks, make sure there are no other medical issues, thyroid, check celiac, check your vitamin D levels are okay. Also, you should be starting an iodine and folate-containing supplement, but also when you've got pre-existing diabetes, the recommendation is that you have a high-dose folic acid supplement, and the recommendation is 5 milligrams of folic acid, preferably starting a month or two before you start trying for pregnancy and continuing it through the first 3 months of the pregnancy. So these are all general things you need to do. Other things you should be looking at doing prior to trying for pregnancy are just making sure that you've got your immunity up to scratch for things like varicella zoster and rubella in particular. And again, these should be done a couple of months ahead of trying for pregnancy. Other issues, apart from just the specifics of looking at how you're delivering insulin and what your level of diabetes control are, is that you should be making sure you've had your diabetes complications assessment, have your eyes checked, make sure that if there is any diabetes eye disease, that it's stable and that your eye specialist is happy for you to proceed to pregnancy. Make sure that your kidneys have been checked, and if there are any concerns, again, seeing a relevant specialist. And then just it is worth going through with your health professionals all aspects of your diabetes management. So even though you may have had diabetes for a long time, just make sure that you're up to scratch with diet and specifically meeting the pregnancy-related diet recommendations, that you're quite confident with your management of hypos and preferably preventing them, of course, and also with sick day management, because once you are pregnant, it is going to be quite a tricky time. And in early pregnancy in particular, you're going to be at more risk of having hypos, so you really do need to be up to speed with that. At any time, if you get unwell, you're going to need to be very good with your sick day management. Now, again, if you're changing over to pump therapy, you'll need to know the specifics of pump therapy, if possible, to try and prevent and deal with these issues as well. So it is preferable, as I've said at the beginning, that you do change over to pump therapy early, if possible, to allow for all of these things to happen and make sure that you're having the ideal self-management skill review and that you're up to speed with whichever form of diabetes management you're having.
Right, thank you very much, Professor Ross. Okay, so Tracy, back over to you. When you moved from injections onto the pump?
Obviously, it's a little bit of a challenging time getting used to something new. Issues, no. I found it a lot nicer to go from 4 injections a day to 1 every 3 days. That was great. And then being able to have the ability now of wearing a wireless CGM and having much better control over my sugars, which has brought my HbA1c down. So no issues as such. Obviously, everything's a learning curve, but it's certainly something that you can pick up quite easily.
Okay, thank you very much for that, Tracy. Okay, so back over to you, Professor Ross. I've had people tell me being on a pump at the beginning of pregnancy is the most important. How important is good control in the early stages?
Okay, so as I've already said, if you're planning to use an insulin pump for delivering insulin, it is preferable to try and be on the pump for as long as possible, both before the pregnancy and through the pregnancy. And in early pregnancy, it is really important to have very good control. So prior to pregnancy and in first trimester, trying to have the glycemic control steady, as good as you can, trying preferably before pregnancy to have an A1C as close as possible to 7% is ideal. But again, minimising hypoglycemia remains a high priority. So the advantage of an insulin pump in the early part of pregnancy is that it can help you reduce the risk of hypoglycemia, which can be extremely troublesome because you become more insulin sensitive in first trimester, particularly between 6 and 12 weeks. And it's easier with a pump to try and manage that. It's also easier if you get a lot of problems with morning sickness or especially if you've got any problems with tummy emptying, gastroparesis, all of those horrible autonomic things. It can be much easier to manage with an insulin pump. So again, being on it ahead of pregnancy to try and use it to advantage to get through that difficult first trimester is something that you should be considering.
Right, thank you very much there, Professor Ross. Okay, so just another quick reminder, guys. If you have that you'd like to post in the live event, please use our Twitter handle, #640GWebinar, or Facebook via Medtronic Diabetes Oz. We've got a post up there ready. And if you're watching this on YouTube, in the comment section below there is also a great place to post those comments. Okay, so next question again for you, Professor Ross. I've often heard how insulin pumps can give you better control and make it easier to stay within range. What is a good range, and how does a pump help control this?
Okay, well, I've probably already made some comments along the lines of this anyway. So again, for many women, the insulin pump can give better control and smoother control by reducing the tendency for high glucose levels and lower glucose levels. So as far as a good range goes, throughout pregnancy, the aim prior to meals, and it's really important in pregnancy to be checking both before meals and after meals. So before meals, you're really aiming to try and keep your glucose levels between about 4 and 5.5. I've already commented avoiding hypoglycemia remains a very, very high priority, and trying to keep all your glucose levels above 4 is recommended. So between 4 and 5.5 before meals is the aim. After meals, if you're testing at around about 2 hours after the start of meal, which would be the usual testing time, the aim would be then to be having your glucose levels between about 5.5 and 7.5. Again, all of these targets are extremely challenging on diabetes to meet, but these are the goals that you're aiming towards, and just trying to get them as close to those ranges as possible. Prior to bed also and through the night, I didn't comment, but again, avoiding hypoglycemia, and usually through the night, you're trying to have glucose levels between about 5 and 6.
Right, thank you very much for that, Professor Ross. Okay, so back over to you, Tracy. Was there a significant change in your insulin intake during pregnancy? And if so, did you find it hard to manage?
I had a significant change in what I needed at the start. It increased a lot for me personally, and then towards the end, which I'm not sure if it happens for everyone, but mine dropped right off, and I had a lot of hypos, and sort of lost actually the requirement for insulin towards the end, which put me into hospital from about 28 weeks. And yeah, I probably just thank my lucky stars that there was such a thing as a CGM, because that allowed me to keep a very close eye on everything. And also with obviously the 640G, it suspends your delivery to avoid hypoglycemia. So that also stopped me from crashing a lot of the time.
Right. Thank you very much for that, Tracy. Okay, so back over to you, Dr. Ross, Professor Ross, sorry. I'm currently in my first trimester, and I'm working closely with my healthcare team to stay in range, but I'm finding it takes a lot of work. Is a pump the answer?
Well, first trimester usually is the hardest time, and it's going to be a lot of hard work, whether it's through multiple injections or through a pump. Again, as I've said already, that the particular issues of nausea and vomiting and being uncertain as to whether you're going to eat, or if you do that you vomit, the pump allows you to be able to organise delivery of your mealtime insulin so that you can have a little bit at the beginning of the meal and then stop the delivery if you find that you're going to vomit and not be able to keep it down or not be able to eat as much as you think. So that can be a big advantage rather than injected insulin, which is sitting there, you've done it, and then you're needing to try and eat or to have enough carbohydrate to match the insulin. So again, there can be some specific features of the pump that can be an advantage. But it is always really, really hard work in that first trimester. That's really the hardest time, I think, for women to control the glucose levels well. It's the highest pressure because the concern is that the critical organs for the baby are forming very, very early in pregnancy. And by the time you've finished first trimester, the baby's organs are in place. So what we're worrying about is swings in glucose levels running too high. That is not a good thing for the baby. And so we know that there is a risk of major malformations, and that even though it's present, there is a risk in all pregnancies. So even not with no diabetes, it's around 2%. But on average for women with diabetes, it's up around the 8 to 9% mark, and markedly relates to the level of A1C. So part of the reason for us trying to keep get the A1C down to around 7 to 7.5% prior to pregnancy is to try and minimise that risk. But also aiming to get to that low level will help reduce the risk of miscarriage in early pregnancy. The tightness of control is a lot of pressure on you when you're pregnant, and again the pump can reduce some of that titer hypos and that concern that you've got. But again, you know, some women find that they don't get better control with a pump, so it is hard to generalise, as it is with every single aspect of diabetes management, as I'm sure you've already realised.
Right. Thank you very much for that, Professor Ross. So guys, just a reminder, if you do have any questions, please reach out to us through Twitter or Facebook or in the comments section under the YouTube video. Okay, so back to you, Tracy. Did you find it was challenging to stay in your target range throughout your pregnancy?
I was very, very tightly controlled in my pregnancy, but I certainly did have times that were tough. Yeah, I guess you have your highs and your lows. I had a very, very big baby about 10 years ago, and I knew the importance of keeping my sugar as good as possible to avoid that happening again. And I kept my sugars great, and I still had a big baby anyway. Thanks for being diabetic. But yeah, it is a challenging time, but I felt personally that with the help of my pump and everything, that things were quite good. Yeah.
Right. Thank you very much for that, Tracy. Okay, so back over to you, Professor Ross. Have many of your patients taken on insulin pump therapy without difficulty? I'm not the best with technology, so I'm worried about using a pump.
Yeah. Okay, so I assure you, you are not alone with feeling insecure about using technology. And I would say that the majority of women that I see would feel as though they aren't great in the technology line, but it really doesn't matter. The majority of women, and obviously that's what we're talking about, women today. The majority of women actually transition onto a pump very, very well, though they will be nervous ahead of it. There is a lot of training that is required, but equally this is supportive training, and a lot of it's going to back onto your general knowledge about diabetes management as well. So working with an educator with experience on pumps, and particularly someone that if you are very confident and comfortable with someone, that will make it a lot easier. But I've really found that nearly everyone who's transitioned onto a pump has managed very well. There are a few that do find it difficult, and that again is just, everyone is a little bit different with things, but I wouldn't be particularly concerned. I would be expecting you to be able to manage it reasonably well and have confidence in it quite early on.
Right. Thank you very much for that, Professor Ross. Okay, so back over to you, Tracy. What would you say is or was the best advantage to using this pump over other therapies throughout your pregnancy?
So I've had 2 pregnancies, and I certainly found that with my second pregnancy and having the pump, that my sugars were a lot easily maintained, rather than having the dramatic highs and the dramatic lows. Yeah, that was probably the best advantage.
All right. Thank you very much for that, Tracy. Okay, so again, back over to you, Professor Ross. With regards to the pump therapy, what would you say to those living with type 1 and planning for a pregnancy?
Okay, so I think that the important issues, as I've already said, are doing all the general planning for pregnancy in the first place. So I think it's really important to look at all the background issues and not just focus on the glucose levels or the form of insulin delivery. And I don't want to underestimate the issues of really working hard at getting good control pre-pregnancy, using contraception up to the time when you're given the go-ahead that, look, everything's in the best possible position. So as far as having type 1 diabetes and planning a pregnancy and considering pump therapy, I think if you are considering pump therapy, it is really important to start looking into it as early as possible and really trying to get very confident with its management. It's still going to require a lot of work, and the ups and downs with the different hormonal changes that are going to occur in pregnancy are going to happen whether you're on pump or you're not, but I do think it is easier to manage with a pump. You can fine-tune the diabetes management, the insulin delivery much more easily with a pump. And the challenge is that you're not ever in a steady state in pregnancy. So when you first find you're pregnant, the pregnancy hormones actually make it a bit tricky to control your glucose levels. They're usually high, a bit like most women would find in the premenstrual stage of the cycle. And that is obviously the stage where you're just getting a positive pregnancy test. You're getting higher readings than you're used to having. It's a bit more unstable. It's highly stressful. And then within the next couple of weeks, you start having hypos and you're needing to pull back on your insulin delivery. You're needing to be super vigilant with things like driving and all other aspects of your management. You may be running into problems with nausea, feeling horrified from early pregnancy. And again, having a lot of contact with the professional, really doing lots of glucose monitoring to try and make it easier. But again, all the adjustments, the settings of the pump, make it quite easy to be able to do that, and somewhat easier than at times you're able to do with the routine way of delivering insulin through injections. And then you sort of get to the second trimester, and usually from about 14 weeks through to about 24 weeks, life's a bit easier. You're not so variable. You do start getting your increase in insulin slowly coming through, but it's a much more stable time. And that, at that stage, usually we're working very hard also at trying to make sure that your diet's really good, that you're not gaining too much weight, because that's one of the other worries and one of the concerns that I do have with the pump is that it's really important to still be as careful as you are with your diet, that you don't try and just think, oh, I can have extra bolus because I'm having extra carbs. If you have high food intake, you're going to gain more weight, and unfortunately you're going to share some of that extra weight with your baby, so the babies will tend to be bigger as well. So the second trimester is really important to try and stay in a steady state as you can with your diet, as well as adjusting the pump. And then in third trimester, usually the insulin requirements are increasing, so it's a pretty unusual what Tracy went through with the drop down of insulin at that time, and certainly I would have been pretty worried if I was seeing Tracy and knowing her insulin requirements dropping. I would agree that admission, watching her like a hawk, was going to be very important, watching your blood pressure and things, because that isn't usual. And we do get worried at any stage if you're seeing something that's outside the square. And again, I think the combination of the pump and the continuous glucose monitoring has got a lot of advantage. So I think I can certainly understand why Tracy found that such a good combination, and I'm sure it helped a lot more in that second pregnancy. And Tracy's had the experience of both ways, so it's probably made a bit of difference. And then the third trimester, and for delivery, you can still stay on the pump. So not everyone can deliver on a pump, but the majority of the time, women who are on a pump through pregnancy are able to still stay on the pump for delivery, whether it's through a vaginal delivery, which is what we aim for, or whether it's through a caesarean. So again, that can lead to a lot of smoothness in the control rather than having to switch over to intravenous infusions of insulin. And I think it allows a little bit more feeling of control when it's you with the diabetes, and that you're still able to have some say in how things are going. So again, a lot of advantages, I think, there. And then for afterwards, with the joys of re-establishing your diabetes control, trying to stay on track when you're having all the new experiences with a baby, and having to restabilise the diabetes afterwards. So again, I think there can be a lot of transitioning points where the pump can have advantages.
Right. Thank you very much.
Long answer, sorry.
That's okay. Longer the better. Okay, so over to you, Tracy. What would be your one piece of advice to someone considering making the switch to an insulin pump prior to pregnancy?
Go for it. Absolutely go for it. For me, I had a lot of struggles with my diabetes for a long time, where I had very high HbA1c and started to see a lot of complications. So just take that plunge. I think it's the best thing I ever did. I know some people are worried about having something attached to them, but literally just fits into your bra. Or you can put it in your pocket or clip it on your waist. Don't be scared about learning something new, because when it comes to health, you've got to do what's best for you. And I mean, if injections work, great, but for me, the pump's been absolutely fantastic. So yeah, I'd just say go for it. Get on a pump. Yeah.
Okay, thank you very much for that, Tracy. All right, guys, that's the end of the webinar for tonight. I just want to say thank you to our guests, Professor Glynis Ross and Tracy, for joining us.
Thanks.
Okay, thank you very much. Yeah. And
No
good luck
guys.
to everyone who wants a pregnancy.
Okay, everyone, just another quick note at home. If you do have any further questions, please do feel free to reach out to us through our global helpline on 1-800-777-808 or via our patient website, medtronicdiabetes.com.au. We've also got our social pages up there, and we're always there ready to answer any questions you might have. Thank you very much, everyone, and have a good evening.
Bye.
Thanks. Bye.
Mm-hmm.